Ever wonder what your body is trying to tell you? Well, radiologists are the experts at listening. So, what if your bones could actually talk? I mean, what kind of stories would they tell? Well, in a way, they can. And radiologists are the ones who listen in. They use something called diagnostic associations. Think of it like expert-level detective work for the human body. All right, let's jump in and decode some of these clues, starting with some common injuries. See this tiny thing called a Sagan fracture? That's a massive clue for a torn ACL. And if you see a similar fracture on the other side, that's a reverse Sagan pointing to a torn PCL. But get this, the clue isn't always just on the scan. It's the patient's story, too. So fractures in both heels actually tell doctors to check for a hidden injury in the spine. Okay, so it's not just about broken bones. These clues can unmask some serious hidden diseases.
For example, an abscess deep in the psoas muscle is a classic sign that could be tuberculosis.
And some patterns in bone lesions are so specific, they're like fingerprints for different types of cancer. Sometimes, even the name of the clue tells a story. Check this out, Looser's zones. They kind of look like tiny fractures, right? But they're actually a classic sign of severe vitamin D deficiency. But you know, one clue often isn't enough. The real magic is piecing them all together. Take Felty syndrome. You combine patient history, a scan, and blood tests, and boom, the diagnosis clicks. And sometimes the clue is super subtle. Even a slightly short bone in the hand can be a major tell. An experienced radiologist builds a mental library of over 60 of these powerful diagnostic associations. And that's their superpower, right? Turning these subtle patterns into quick, life-saving action. But now AI is learning to spot these patterns too. So you have to wonder, what's the next superpower?